The CDC, America's top agency for disease control and prevention, is going through a major shakeup, with high-ranking scientists resigning in response to Trump administration policies they say are shaped by ideologies rather than science. Dr. Deborah Hoory was one of those who stepped down.
We became aware by conversations with work groups that many of them were deciding on what recommendations would be before actually having the data. And for us, that's problematic. As scientists, you should never know in advance what you want the data to show.
The resignations followed the recent appointment of vaccine skeptic Jim O'Neill to lead the agency after the previous CDC director was fired after just a month. Critics say the move could derail decades of progress in public health.
The CDC started in 1946. The life expectancy went during that period from then to now from 66 to roughly about 78 years. The damage that's being done right now to the CDC, both directly through financial cuts, directly through cutting personnel, and indirectly through misinformation and disinformation coming from HHS, is causing what I'm afraid will be irreparable damage to the CDC.
Appointed by President Trump to lead the Department of Health and Human Services, Robert F. Kennedy Jr., a longtime anti-vaccine activist, has vowed to make America healthy again by addressing the underlying causes of chronic diseases. But observers warn that funding cuts on research and limiting access to vaccines could set the country back years in pandemic readiness.
If you don't get vaccinated against influenza or COVID or respiratory syncytial virus, those three we're going into the winter season and we're going to be seeing a lot more of these infections, you're increasing your risk of getting seriously ill, hospitalized, and dying. We have plenty of data to support that.
The CDC's own data shows COVID-19 vaccines have prevented over 3 million deaths in the U.S. alone. But with research funding slashed and federal support dwindling, public health experts warn the nation will be less prepared for the next pandemic. Ediz Tiyansan, CGTN, Los Angeles.